K4 News at 4.
Okay, if you spent any time outdoors over the past few days, maybe you felt it. Fall allergies are here, and doctors say the symptoms can be similar to those of COVID-19. Joining us now is Dr. Meredith Dilley with Arkansas Otolaryngology. Dr. Dilley, besides President Trump testing positive for COVID-19, we also learned today that Senator Mike Lee of Utah also tested positive, and he said he had symptoms consistent with allergies. Can you help us kind of separate these two, if we can?
Absolutely. So there are some unique symptoms that allergy sufferers typically describe that are unique from COVID. The ones that patients who suffer from allergies typically describe would include nasal itchiness, throat itchiness, itching in the ears, and also sneezing is a fairly common symptom of allergies that, while can be seen in COVID, is not one of the common symptoms.
So how do you know what the difference is?
Well, so most patients who have allergies are maybe not long-time sufferers, but have experienced allergies in the past. So, for instance, right now we're in the middle of ragweed season, and so patients who have had seasonal or fall allergies in the past would typically recognize those symptoms as they come up in the fall. And so usually people who have allergies would recognize those symptoms as they've had them before.
And I guess if somebody is confused or if somebody might not know what the difference is, just get tested for COVID.
Absolutely, and I've told my own patients that if you are concerned or something feels different to you, absolutely get tested. Some of the unique symptoms that you can have with COVID that you don't typically see with allergy would be extreme fatigue, feeling run down, and then of course we've all heard about coughing, shortness of breath, which doesn't typically come along with just routine seasonal allergies.
Okay, so really the fact of the matter is get ready, right?
Yeah.
Just out of curiosity, because whenever we talk to somebody, especially when it's allergies, everybody wants to know, is this year going to be worse?
It's hard to predict. I think it's a pretty, as of yet, it's a pretty typical fall allergy season. You know, you hear about ragweed more than anything, but there's countless other weeds and mold this time of year that people who have allergies are well aware of. What I've encouraged my patients, and I would encourage anyone who knows themselves to be a sufferer of allergies, is to remember to start your routine allergy medications early and now, to prevent some of those symptoms and potential confusion between allergies and a COVID infection.
Dr. Meredith Dilley, thank you so much for your time. We certainly appreciate your medical expertise. We want to continue to follow breaking news at this